Hello, dear friends. Today I want to talk a little bit on the introduction to the PLAB2 exam. I have four chapters today to discuss. First of all, the marking scheme of the PLAB2 exam. Number two, the orientation to the clinical assessment center, the general information on the GMC green and the blue circuit. Number three, the type and the format of the PLAB2 stations. And number four, approach to the history-based station. I would like to start my discussion with discussing the marking scheme of the PLAB2 exam. This is very important. For any exam, as you start preparing for that particular exam, you need to know the marking scheme of that exam inside out. I have seen many candidates preparing for the PLAB2 exam without knowing the exact marking scheme, without knowing what exactly the GMC expects from you. And the result, undoubtedly, they will end up failing this exam. Therefore, very important is to understand the marking scheme. And my job today will be to make you understand what exactly is the marking scheme of the PLAB2 exam. I'll give you different examples and will explain you accordingly. Number two, I will try to orient you to the clinical assessment center of the GMC in the Manchester, and I will give the general information on the GMC green and the blue circuit. Why I am doing this? I'm doing this because I want you to be familiar with the clinical assessment center so that you will not be very anxious when you go there on the exam day. Everything looks familiar to you. Okay. Number three, I'd like to discuss on the type and the format of the PLAB2 stations. I think there are altogether 6 different types of the PLAB2 stations. I would like you to explain about those types, and I'll also make you understand and identify the PLAB2 stations nicely, and I'll tell you what is the advantage of identifying the PLAB2 stations in the exam. Number four, I will be discussing the approach to the history-based station. So I have told that there are altogether 6 categories of the PLAB2 stations. Among them, history-based station is one of the category. I'll discuss the general approach to all kind of history-based station. So these are 4 things that I'd like to discuss today. Let's move forward. Let's first of all go into the first chapter, the marking scheme. So here I have taken a report card of a candidate who failed this exam, and I'll give you some important insight about this exam from this report card. Okay, so the first thing that I want you to know is that there are altogether 18 stations in a given day. There are altogether 18 stations in a given day, and you will be marked in out of these 18 stations. Sometimes GMC will withdraw 1 or 2 stations depending upon the candidate's performance and various other reasons. If that is the case, then your passing station, the number of stations that you need to pass will also decrease. Okay, and what GMC does is that GMC give you the feedback on 2 different areas. One is on the domains, the data gathering, technical and assessment skill domain, clinical management skill domain, and IPS domain. And they will also give you the feedback on the skill areas. Now, what are the domains? So there are 3 domains in which they will mark you. All these domains has got maximum of 4 marks. So a particular station will have 4 plus 4 plus 4, 12 marks in total, and out of that there is a designated pass score needed for that particular station, and you need to pass that station individually to pass or fail that station particularly. Okay, so for example, in this candidate, in the station number 1, acute back pain, he scored 3 out of 4. He scored 2 out of 4, and he scored 3 out of 4 in all these respective domains. The total score he scored was 8, and the pass score needed was 5.63, and he passed this station. Okay, now let's move into the third station. Let's move into the fourth station, distended abdomen. He scored 1 out of 4 in the data gathering, technical and assessment skill, 2 out of 4 in clinical management skill, and 3 out of 4 in IPS. Therefore, his score was 6. Total score was 6. The pass score needed was 6.6, and that's why he failed this station. Now, to understand what are the skill areas that he was lacking so that he failed this station, you need to move into the skill area section of the report card. In this station, distended abdomen, in which he failed, there are 10 different skill areas: consultation, diagnosis, examination, findings, issues, language, listening, management, rapport, and time management. And he was poorly marked on consultation, diagnosis, examination, findings, and management, though he was good on issues, language, listening, rapport, and time. Okay, so understand that if you are performing poorly in these 5 skill areas out of 10 skill areas, the result will be a failure. Okay, so make sure that you are trying to give your best shot on all 10 different skill areas. Okay, so this is how you see your mark sheet. Now the other thing is that, as you can see the pass score needed in all the stations, you can see there is some particular pattern. What are the pattern? You can see that there are at least 1 and 2. So there are at least 2 to 3 stations in the PLAB 2 exam where the pass score needed is more than or equal to 7. That means since your pass score comes in the decimal, okay, but your real score does not come in the decimal, it will be whole numbers. So that means if the pass score needed is greater than or equal to 7, that means 7 point something, you need to score at least 8 to pass those stations. Therefore, keep in mind that 2 to 3 stations in the PLAB 2 are always difficult to pass. They are always difficult to pass. Scoring 8 out of 12 is a bit difficult task. So 2 to 3 stations are always difficult to pass. Okay. So always keep in mind that you have at least 2 to 3 stations. You have to keep the margin of error for at least 2 to 3 stations. Okay, don't feel that I have passed 11 stations, I have performed well in the 11 stations, so I will pass in this exam. No, you need to pass at least 13 to 14 stations on your own perspective so that you will be in the safe zone to pass this exam. Okay, now see others. In the other station, you can see here that there are 1, 2, 3, 4, 5, 6, 7. Okay, so 5 to 7 stations in the PLAB 2 exam are having the pass marks of above 5. That means 5 point something. Okay, so that means you need to score at least 6 to pass. So 5 to 7 stations in the PLAB 2 exam are always easy to pass. Always easy to pass. Scoring 6 in the PLAB 2 exam are always easy. Okay, so 5 to 6 stations are always easy to pass. However, the remaining bulk are the stations which have the pass marks of 6. Okay, that means you should score at least 7 in these stations to pass this exam, to pass this station. That means that your deciding stations are those stations which has the pass marks around 6, not those stations which has pass marks around 7, and not those stations which are pass marks around 5. Okay, so that means in average you should score 7 in most of the station to pass this exam, Okay, now the other important thing that I would like to highlight here is, now see, this particular station, elderly man with questions about his medication, he scored 4 out of 4, 3 out of 4 and 4 out of 4, so he scored 11. This is pretty high marks. Okay, and he passed this station. Okay, now he is scoring 11 or 12. It does not mean that he was perfect in this station, but it only means that out of the 72 candidate that was giving the exam on the same day, he scored best among all those 72 candidates. Okay, he performed better than all those 72 candidates, and that's why he's getting high marks. If you are getting low marks, for example 2 to 3, don't get disheartened. It does not mean that you are a bad doctor. It just means that those 72 candidates who are sitting on the same day on that particular exam performed quite well than you, and that's why you got low marks. Now, this will also give an important insight to you that your total score is not your absolute score. Your total score is not your absolute score. Your total score is your relative score. Okay, so these scores are in comparison to the other 72 candidates who are giving the exam on the same day. Okay, so don't get misled by the fact that you are getting good marks, that means you are a good doctor, or you are getting bad marks and you are a bad doctor. No, that is not the truth. Okay, it is just the comparative marking with the other candidate. Now, what is your absolute marking? Your skill areas is your absolute marking. This is not in comparison to others, but this is according to the feedback given by the examiner to you of that particular station. So that means whenever you are practicing with your friends, whenever you're doing one-on-one practice with your friends, do not give feedback to each other based upon these 3 domains. That is the main mistake candidates are doing. What candidates are doing they are doing 8-minute face-to-face practice, and they are trying to analyze their colleague, each other, while practicing, and they are saying that, okay, you are scoring good on the data gathering domain, you are bad on the management skill, you are good on the IPS, so I will pass you on this station. No, don't do that. what you do is you give the feedback to your colleague based upon these 10 skill areas, which is very important. Okay, because you can never judge a colleague on these 3 domains until and unless you see the other colleagues on that particular station. Therefore, your job is to analyze your colleague on 10 skill areas, say to them that whether they did good on the consultation or not, on the diagnosis, on the examination, on the finding issues, and so on. Okay, so this is a small piece of information from one of the report card of a candidate who failed this exam, and I hope I gave you some important insight on this particular marking scheme. Now, after knowing about the report card, let's move into the section in which I discuss how to pass this exam. There are altogether 18 stations. Okay, there are altogether 18 stations, and out of these 18 stations you have to pass at least 11 stations to pass this exam. And not only that, you also have to pass on the total pass mark as well. Okay, so for example, if in a given day, if the pass mark is 122, you have to cross this 122 as well, and you have to pass altogether 11 stations out of 18 stations. Okay, now the thing is, sometime in the GMC report card you will not see the 18 stations. They can sometime withdraw 1 or 2 stations depending upon the performance of the candidate and various other reasons. Now, if there are altogether 16 stations in the GMC, that means the number of stations to pass this exam is not 11, but it is 9 if it is 16 stations. Okay, if it is a 17 stations, then the number of stations that you have to pass is 10. Okay, so it's like x minus 7. So if there are 18 stations in a given day, you have to pass 11 stations. If there is 17 stations in the given day, you have to pass 10 stations. If there is 16 stations in the given day, you have to pass 9 stations. And you also have to pass the given pass mark of the day. Now, what is the given pass mark? So the given pass marks of the day is the addition of all these scores. So after adding this, you will get 122 here in this particular day. So in the GMC, the pass score ranges from 110 to 125. It can go as low as 110. It can go as high as 125. It depends upon the difficulty of that particular day. If the exam is quite difficult, the pass mark will be very low, around 110. If it is quite easy, then the pass mark will go very high, around 125. So now let's move into the domains. As you know that there are 3 domains, and this is the screenshot taken from GMC. So these 3 domains are data gathering, technical assessment skills, clinical management skills, interpersonal skills. In the data gathering, many people are thinking that it's only history taking that's coming under the data gathering, but no, it's not in fact the truth. Apart from history taking, there is physical examination, practical procedure, investigations, all leading to the diagnosis. Okay, so history taking, proper physical examination, if there is any procedure to demonstrating the procedure nicely, and then verbalizing the proper investigation to lead to the diagnosis is all coming under the data gathering, technical and assessment skills. For the clinical management skills, you have to formulate a working diagnosis, explain something to the patient, and formulate a management plan. Now, the diagnosis and the management plan itself are 2 important skill areas which I will discuss very shortly. The third domain is the interpersonal skills. This depends upon how you approach the station, whether you establish a rapport with the patient, how you use the open and the closed questioning, how you involve the patient, and did you demonstrate your professionalism and understanding of the ethical principles. So there are a few things. Number 1 is about the rapport. Number 2 is about moving from the open-based question to the closed question. Do not directly ask the closed questions. And then also you have to involve the patient. It should be patient-centered consultation. It's not that you are doing some one-way communication. You have to involve the patient. You have to demonstrate the professionalism. Okay, you should be professional. You have to demonstrate the professionalism, and then you also have to understand the ethical principles. Okay, and that will ensure that you will get good mark in IPS. Now, apart from that, there are 10 different skill areas. Okay, so I will explain what are these 10 skill areas. So these are also taken from the GMC's website. So the first skill area is consultation. To score good in consultation, your consultation should be structured and ordered. It should be logical, and there should be reasonable line of questioning. That means the questioning should be non-erratic. Okay, So this generally means that if you are taking a history, if you are just moving sometime from the history of presenting illness to the past medical history, then again to the history of presenting illness, sometime to the personal history, if you are going haphazard like that, then your consultation is not structured and ordered. In such case, you will get poor marks in consultation. Okay. Now, how about the diagnosis? If you are making a correct working diagnosis and are also formulating the differential possibilities, then you are getting good mark in the diagnosis. If not, then you are getting poorly marked in the diagnosis part. On the examination, you have to undertake the physical examination competently and you have to use the instruments proficiently. Okay, but sometime the station is not examination based station, it is a history based station. In such case, you have to verbalize the proper physical examinations competently. Okay, and that way you will ensure that you will get good mark in the examination section. Now coming to the findings. On the findings, you have to identify abnormal findings or result and recognize their implications as well. Okay, so if there is any abnormal finding from the history, from the investigation report, from the examination part, you need to identify it and you need to also recognize their implication, whether it is acute, whether it is chronic, whether it should be addressed properly, whether it should be ignored, things like that. If you are doing that, then you are getting good marks in findings. Otherwise, you are getting poorly marked in the findings. Issues: whether you are recognizing the priorities, whether you are understanding the key problems, and whether you are managing if patient is acutely ill. For example, if the patient is coming with the giant cell arteritis like picture in the A&E department and he also has a smoking history, then do not lose your time by just giving the lifestyle advices on smoking history. If you are doing so, then you are not recognizing the priority. The priority is not the lifestyle modification. The priority is to prevent the potential loss of vision. So if you do that, then you will get poorly marked in the issues. Otherwise, you will be getting good marks in issues if you are recognizing their priorities and understanding the key problem and immediately managing if something is acutely ill. Another thing is language. It does not mean that your language should be of good accent, you should use the good vocabulary, but it just means that your language should be relevant and understandable. You are not using medical jargons quite a lot. You are explaining it in the understandable way and you are checking the patient's understanding at the same time, asking questions like, are you following me? Are we on the same page? Are you happy to try this and that? Okay. Listening. If you are doing the adequate use of the verbal and the non-verbal cues, you are getting good marks in the listening. Okay, so what is about the verbal and non-verbal cues? If the simulator says, doctor, I am having some problem in my work, then you pick up the verbal cues. Well, your work is obviously quite important. I'll come back to it very shortly. Sometimes the patient is showing some non-verbal cues. He is holding his hand constantly on his chest. Okay, so this means that there is some problem in the chest. So you can say, I can see that you are holding your hands on the chest. Is everything all right? So you are taking the non-verbal cues as well. So if you are picking up the verbal and the non-verbal cues, you are getting good marks in the listening. Likewise, if you are giving full attention to the patient's belief, agenda or preference and act on them, then you are also doing good on the listening. So this indirectly means that you have to ask about ideas, concerns and expectations in order to perform good on the listening aspect. Let's move forward. On the management part, which is also the important skill areas to master in the PLAB 2 exam, you have to formulate the management plan and it should be according to the current guidelines. Okay, sometimes some candidates are giving the management plan of the stroke from ABCD2 criteria. If you are using this criteria, that means that you are not using the current guidelines. ABCD2 criteria in the stroke is already outdated. So make sure that you are using the current guidelines, the current NICE guidelines and SIGN guidelines when you are managing the case. Okay, and you should be formulating a plan. Do not say everything in detail, just formulate a plan, give the overview, because don't forget the fact that you are also a junior doctor. Then you have to give the follow-up plans, when to follow up. Okay, and then after that you also have to give the safety netting, the advices on when to return to A&E or when to call 999 if in case of some emergencies. Okay, so this ensures that you will get good marks in the management, otherwise you will be marked poorly on the management. The ninth skill is a rapport. What is exactly the rapport? Rapport means you are making a good connection with the patient with each other. Okay, that means you are sensitive to the patient's feeling or concern. You are not using the stock phrases. Saying every time I am sorry to hear that is the use of stock phrase. Do not use that. Okay, use only it in appropriate places. And you should conduct a patient-centered consultation. You should show the appropriate empathy or sympathy, and you should also seek the agreement to the management plan. For example, if the patient is of a type 1 diabetes mellitus and the patient is thinking that you will give something in the form of a medicine to control his diabetes, but you are thinking in the line of insulin, that means you are not seeking the agreement to the management plan. So what you do is you explain the diagnosis, you explain your treatment methodology, and then also seek the agreement to the management plan, like by asking the question like, are you happy to try this out? The next skill area is the time management. You should be showing the proper time management in all the stations. So you have altogether 8 minutes to complete this station. On the 6th minute, you will hear a warning bell. So if you are hearing a warning bell, just try to wrap up that station in next 2 minutes. Okay, do not continue whatever you are doing in this 6 minutes, because that way you will not be able to complete that station in the 8 minutes. You'll also get the 90 seconds outside the room where you can read the task and formulate some ideas on your head. Okay, so 90 seconds outside the cubicle and 8 minutes inside the cubicle. So this is your time, and you have to do the proper time management. It also means that you are investing time at more important areas and balancing it in the lesser important areas. Okay, so if you are investing more time on the sexual history in the station where it is not required, that means you are not showing the proper time management. Okay, so that is also that needs to be considered. So there are these 10 skill areas. Likewise, there are these 3 domains. Okay, and in this way this will be reflecting on your report card like this. So this is about the marking scheme.